CIO Whisper. I just got my hands on Bravora PharmaCorp's internal CIO memo for 2030. It reveals exactly how they're planning to use quantum computing to slash drug discovery costs by $2 billion. But here's what shocked me most: the 3 critical mistakes every other pharma company is making right now. Disclaimer: Bravora is a fictional entity used only for illustration. Any resemblance to real companies is purely coincidental. Inside Bravora's PharmaCorp, AI wasn't just another tool. It was expected to transform drug pipelines and boardroom decisions. But the deeper story isn't about algorithms, it's about leadership choices. In Bravora's PharmaCorp 2030 CIO memo, one fact stood out. Every extra month in drug discovery was costing over $150 million in lost opportunity. The CIO concluded only quantum computing could compress timelines enough to keep R&D alive. Bravora's PharmaCorp CIO memo didn't just warn about collapsing timelines. It spelled out the cost of hesitation, billions lost, patents slipping away, and R&D pipelines drying up. Their message to peers was blunt: adapt to quantum or risk becoming irrelevant. Bravora's PharmaCorp CIO memo didn't start with bold promises of quantum breakthroughs. It opened with a blunt admission: drug development timelines were collapsing under cost pressures. By 2025, the industry was bleeding billions and waiting decades for new therapies. That's why their pivot toward quantum wasn't hype, it was survival. Bravora's PharmaCorp 2030 blueprint gets concrete: this is hybrid, not hype. Quantum computing takes the hard chemistry, GPUs drive the learning, and one lakehouse feeds them both. A workflow engine routes each job to the fastest path, shrinking weeks of simulation into overnight design sprints. Bravora's PharmaCorp CIO memo didn't just talk technology. It laid out how quantum computing could rescue research pipelines bleeding cash. By offloading the hardest molecular puzzles, they believed quantum computing would slash years of trial and error into months of precision. Here's the roadmap section of Bravora's PharmaCorp 2030 CIO memo. It begins with Phase 1, assessment and pilots. The CIO pinpoints workloads suited for quantum acceleration, molecular simulations, protein folding, and generative models for drug targets. Early pilots with IBM, IonQ, and Google Quantum are marked for immediate execution. Phase 2 in the memo is all about infrastructure. The CIO stresses hybrid integration, quantum coprocessors linked with SAP S/4HANA and existing HPC clusters. Every clinical trial dataset, ERP log, and supply chain node must be quantum-ready by 2032. The third phase is people and governance. The memo outlines a quantum academy, retraining 3,000 data scientists, chemists, and IT leaders. Cybersecurity, compliance, and ethics are mandated as core pillars. Finally, Phase 4, scale and partnerships. The CIO memo marks 2035 as the point when all clinical trials should run with quantum assistance. By then, Bravora's PharmaCorp expects quantum-first drug discovery to save over $2 billion annually. And global alliances with regulators and universities will lock in long-term leadership. The roadmap closes with a bold vision. By 2040, Bravora's PharmaCorp envisions a quantum-first ecosystem, where every molecule, trial, and supply node is modeled in real time. It's not just about efficiency, it's about redefining how medicine itself is discovered. The roadmap doesn't end here. What comes next is execution, and the risks CIOs must navigate in turning vision into reality. If you're a CIO, this is where strategy turns into your next big decision. Here's the moment where vision meets proof. Bravora's PharmaCorp runs a direct comparison, a classical LLM versus a quantum-enhanced LLM. The difference isn't subtle, it's a leap. With quantum acceleration, molecule screening doesn't crawl through data, it surges. What took months is now reduced to days. And predictions surface before rivals even finish their first pass. In Bravora's PharmaCorp 2030 CIO Memo, quantum-first LLMs don't just crunch probabilities. They simulate futures, predicting drug approvals, patient response, even market resilience. For CIOs, this isn't about dashboards. It's about choosing which future to bet on. But predictions mean little without proof. In the Bravora's PharmaCorp 2030 roadmap, every forecast ties to measurable metrics, trial timelines, cost savings, regulatory speed. Execution isn't judged by vision. It's judged by numbers. In the boardroom, the conversation shifts from technology to economics. Bravora's PharmaCorp CIO projects that quantum computing-enabled R&D could unlock $2 billion in savings. This isn't just cost reduction, it's a strategic head start competitors may never recover from. But the numbers alone don't tell the full story. Bravora's PharmaCorp isn't just saving money, it's buying time to market. In pharmaceuticals, that time can mean billions in revenue, or being left behind. Competitors who wait for maturity will miss the inflection point. Bravora's PharmaCorp is already investing, ensuring that when quantum computing goes mainstream, they're years ahead. Innovation delayed is opportunity lost, and in R&D, those lost years are priceless. Analysts warn that disruption doesn't wait for consensus. By 2030, Bravora's PharmaCorp expects quantum computing to compress drug discovery cycles from years to months. For competitors, hesitation means arriving late to a market that's already been claimed. The Bravora's PharmaCorp CIO Memo frames quantum computing not as a gamble, but as insurance. Investing early protects against disruption and positions the company to define the future of pharma innovation. In 2030, the risk isn't adoption. The real risk is standing still. In Bravora's PharmaCorp 2030 roadmap, one truth stands out: quantum computing isn't just about faster simulations. It's about reshaping how CIOs everywhere plan workloads, talent, and governance. These lessons don't belong only to pharma, they belong to every enterprise preparing for the decade ahead. First, CIOs must ask, which workloads are truly quantum ready? Not every process belongs on a quantum processor. Clarity in selection defines early success. Second, pilot programs matter. CIOs should launch contained, hybrid tests, proving value in narrow domains before scaling. This de-risks investment and accelerates boardroom confidence. Third, talent and governance. Quantum computing without skilled architects or clear guardrails is just chaos in disguise. Bravora's PharmaCorp CIO shows that investing in a quantum center of excellence and building governance frameworks is not optional, it's survival. Fourth, AI and LLM pipelines must be re-engineered for a quantum world. It's not about replacing today's infrastructure, but preparing semantic search, model training, and pipelines to plug seamlessly into tomorrow's quantum accelerators. These universal lessons reveal a bigger truth: the CIO role is being rewritten. From workloads to governance, from pipelines to talent, quantum computing is forcing leadership transformation. Bravora's PharmaCorp shows the playbook. The question is, will your enterprise follow or fall behind? In Bravora's PharmaCorp leaked CIO Memo, one truth stands out: every other pharma is falling into three deadly traps. First, rushing pilots without a clear quantum roadmap. Second, underestimating the talent and governance needed to scale. And third, treating AI and LLM pipelines as side projects instead of core strategy. These are the mistakes Bravora's PharmaCorp is determined to avoid. This channel doesn't chase trends or rely on talking head commentary. It produces faceless, CIO-grade case studies, each one built through multiple iterations, with research, storyline testing, and careful visual pairing. The goal isn't to provide cookie-cutter answers, but to spark recognition at the boardroom level. CIOs and enterprise leaders return here for clarity, depth, and impact, not surface-level noise. That's why CIO Whisper exists. This is CIO Whisper. The future's moving fast. Subscribe for future-proof insights, or get left behind. CIO Whisper.